This is the periodontal assessment project, which is a requirement for advanced clinical procedures class presented by Chavelli Silvestre. The patient chosen for this case study is Bill Smith, who is an 80 years old male, Caucasian. He usually eats a lot of candies. He is a widower in a wheelchair due to a dysfunction in the spinal cord and lives in a nursing home and has two children. My patient has Parkinson's disease and physical impairment, which is involuntary muscle movement. The medication he is taking for these conditions are Parloder 1.25 to 2.5 milligrams orally once a day. Should be taken with food to reduce side effects. Psychotic disorder, high blood pressure, and pituitary disorders are contraindications for this medication. The other effects of this medication is xerostomia. The other medicine he is taking is atropine, 0.4 milligrams orally every 4 to 6 hours. The patient should avoid driving because of dizziness. Kidney disease and myasthenia gravis are contraindications for this medication. Changes in taste and xerostomia are other effects of this medication. In this slide, we're going to present the periodontal probing. This patient was classified as an ABA generalized case type 3 and localized case type 4 periodontitis. This patient is missing teeth number 1, 13, 16, 17, and 32. The deeper pockets were found on teeth number 2, 14, 18, 19, and 30, in which the patient also has recession. This patient has generalized bleeding and forcations number 1 and 2 on teeth number 2, 14, 19, and 30. This patient also has mobility class 2 on teeth number 4 and 12. For the AAP periodontal classification, patient has non-plaque-induced gingivitis due to systemic disease and medications. Patient has aggressive periodontitis localized and severe clinical attachment loss equal or more than 5 millimeters. Patient presents systemic autoimmune disease, and in the statement, patient presents with generalized non-plaque-induced gingival disease due to Parkinson's disease and the medication for this condition. Patient has localized severe periodontitis associated with moderate clinical attachment loss on teeth number 2, 3, 14, 15, 18, and 19. For the ADA, patient was classified with class 3 moderate periodontitis generalized with probings of 4 to 5 millimeters. Bleeding, recession, furcation class 1 and 2 were present. The radiographs found alveolar bone 3 to 4 millimeters below the CEJ, horizontal and vertical bone loss, and 3 to 4 millimeter clinical attachment level. For class 4 severe periodontitis localized, the probing is equal or more than 5 millimeters. Bleeding, recession, furcation class 2 and 3, mobility 1 and 2 were present. Alveolar bone 5 millimeters or more below the CEJ, horizontal and vertical bone loss, 5 or more millimeters clinical attachment loss, and more than 30% of radiographic bone loss. Gingiva description. The gingiva color is localized and its distribution is from the free to the attached gingiva and papillary. The severity is moderate and the quality is dark red or cyanotic chronic and blanche. The gingiva contour is generalized and its distribution is from the free to attached gingiva and papillary. The severity is severe and also has rolled, rounded, fistule, and receding margins. with created bulbous and cleft papilla. The consistency of the gingiva is generalized and its distribution from the free to the attached gingiva, and the severity is severe, and the quality is soft, spongy, and swollen. The surface texture of the gingiva is generalized, and its distribution is from the free to the attached gingiva and also include the papillary. The severity is severe, and the quality is shiny, loss of stippling, and fibrotic. In the next slide, we're going to present the assessment statements. We pick two pictures of our patient. One is a radiograph and the other is an image of the gingiva. The AAP statement states that the patient has generalized non-plaque-induced gingiva disease associated to Parkinson's disease and the medications for this condition. Patient also has localized severe periodontitis with moderate clinical attachment loss on teeth number 2, 3, 14, 15, 18, and 19. The ADA statement says patient presents generalized bleeding and inflammation associated with gingivitis throughout the dentition. Patient presents generalized signs of moderate periodontitis and localized type 4 periodontitis, with advanced signs of gingiva attachment loss on fascia of teeth number 2, 3, 14, 15, 18, 19, 30, and 31. Also, class 1 and 2 furcations are present in teeth number 2, 14, 19, and 30. The radiographic findings support evidence of horizontal and vertical bone loss and alveolar bone reposition up 9 mm below the CEJ, which correlate with the oral exam and periodontal diagnosis of localized case type 4 and generalized moderate periodontitis case type 3. For the gingiva descriptive statement, the gingiva color appears localized dark red or cyanotic. The gingiva contour presents as generalized rounded and rolled margins with moderate gingiva recession. For the gingiva margins appears with localized bulbous, crater, and clefted areas. The gingiva consistency presents generalized swelling and spongy from the gingiva to the papilla. The gingiva surface texture appears shiny, with severe loss of stippling throughout dentition from the free gingiva to the papilla. In this radiographic image, we can find horizontal bone loss 4 to 6 mm below the CEJ, a minimum grade 2 furcation, recession, and vertical bone loss. In this gingiva image, we can see loss or stippling, blunted gingiva, attached gingiva is spongy and shiny. We also can see calculus deposit, dark pink to bright red gingiva color, and gingiva enlargement. In the next gingiva image, we can find roll margins, calculus deposit, margins moderate clefting, bulbous papilla, dark pink to bright red gingiva color. The patient also has hyperkeratosis and loss of stippling, and free gingiva is spongy and shiny. In this gingiva image, we can see recession, severe vault and rounded margins, margins moderate clefting, moderate red gingiva with fibrotic tissue, calculus deposit. The gingiva is spongy and shiny, and bulbous margins. In the last gingiva image, we can find calculus deposit, moderate red gingiva with fibrotic tissue, dark pink gingiva color, margins moderate clefting, severe vault and rounded margins, and crater gingiva. In this slide, we're going to present the dental hygiene diagnosis. The prognosis for this patient is poor. The rationale: patient presents moderate to advanced bone loss and grade 1 and 2 furcations. Due to the presence of systemic factors together with doubtful patient cooperation, the areas with localized severe periodontitis has questionable prognosis, while the rest of the periodontium with moderate periodontitis has a more hopeful outcome. The patient outcome to reduce periodontal pathogens and inflammation through the mouth, and effective management of the furcations. The therapeutic goals: short term, eliminate bleeding and inflammation with non-surgical treatment, for example SRP, irrigation with Petidex at the dental office and use at home for 7 days every 3 months, home care instructions. The long-term goals: reinforce oral hygiene care, perio maintenance every 3 to 4 months, and nutrition analysis. The modifiable risk factors: reduce sugary intake, nutrition counseling, home care instructions to patient and nursing home caregiver, improve xerostomia and physical therapy. Non-modifiable risk factors: disease, Parkinson, and the medication used to treat Parkinson, for example, Paloder. This is the treatment planning. The ADA codes in red are the ones that we're going to use for this patient. In the next slide, I'm going to explain each one of these codes. Treatment plan flow chart. In the first appointment, we're going to do a comprehensive initial evaluation, which includes periodontal screening. In the same appointment, we're going to start the treatment with preliminary debridement and oral hygiene instruction. For the next appointment, we're going to start with scaling root planning for 4 or more teeth and periodontal scaling for 1 to 3 teeth, depending on how many teeth we need to treat per quadrant. In this appointment, we're going to deliver antimicrobial agents via controlled release vehicle into clavicular tissue and gingival irrigation per quadrant. For the maintenance appointment, we're going to perform a periodontal maintenance, a localized delivery of antimicrobial agents, and gingival irrigation per quadrant. For the following appointment, we're going to do the limited oral exam, problem focus, and periodic exam twice a year. For the prevention, we're going to apply topical sodium fluoride, also oral hygiene instruction, and we're going to train the patient and the caregiver in the oral care. Instrument selection for this case type: Graces, the Mini 5, which is graded access to tight narrow periodontal packets and complex furcations; the standard curette, which is for light to moderate calculus removal; the rigid curette for moderate to heavy calculus removal; and the Anna Pattison instrument for perio maintenance. The scalers: the Nevi 1 and H5, which is an elongated disc and for anterior lingual stain and calculus removal, paired with a larger H5 circle for interproximal and cervical areas. The ultrasonic insert, the magnetostrictive insert, the FSI 1000 for moderate to heavy calculus; the FSI Slimline 10 for biofilm to moderate calculus; the Aster 5 straight right and left for better adaptation in interproximal areas; and the piezo insert Diamond 2R for access deep periodontal pockets and furcations. Patient's home care recommendations: prescription dental aids, 0.12 chlorhexidine gluconate rinse, alcohol-free; toothpaste with fluoride; I want to point out that we didn't prescribe Cleanpro 5000 toothpaste because this patient didn't present any caries. OTC Dental Ace Floss Handle Style Floss Holder. This is the best option for Parkinson's disease patients. Biotin to reduce xerostomia. The toothbrushing. Even though when bath technique is the most recommended for perio patients, in this occasion we're going to recommend the Stillman technique, which covers the root exposure and furcations when brushing. The tire brush is electric salt toothbrush, which has a wide handle, easy for Parkinson patients. The special instruction: use your stronger arm for brushing. Brush teeth and gums gently after every meal. Caregiver aid when needed. The toothpaste. Regular toothpaste with fluoride. Special instructions: if patient experiments taste changes, can switch the toothpaste. Floss and floss aid. Tie handle style floss holder. The water pick cordless. Special instruction: slowly move the water pick while slanting the tip at 90-degree angle around each tooth. I want to point out that the water pick is the best option for these patients for grabbing and holder. Interdental aid. Tie gum stimulator. Special instruction: massage gums gently. Mouth rinses. Tie 0.12% chlorhexidine gluconate alcohol free. Mouth rinse with fluoride and alcohol free. Special instruction for fluoride rinses. If switching and spitting are difficult, the dentist may recommend a brush or sponge applicator. Fluoride. Toothpaste and mouth rinse with fluoride. Special instruction: use them daily in the normal oral hygiene routine. Products to avoid. Avoid mouth rinse with alcohol for xerostomia and burning. Nutritional analysis. Disease: Parkinson's disease. Symptoms: tremor, arrest, slowness of movement, stiffness of the limbs and body, impaired balance. Patient with this condition needs to increase the intake of folic acid, vitamin B6 and B12, zinc, omega-3 fat, and magnesium. Vitamin D deficiency is usually present. Medication: Parlodel, may cause xerostomia and taste changes. Should be taken with food to reduce side effects. Condition: physical impairment. The body's lack of a full range of motion, body injuries, difficulty holding or manipulating objects, and carrying out specific tasks. Vitamins A, B, and D deficiency. Risk for anemia. The patient with this disease or condition should add to the diet a whole grains, vegetables, fruit, milk, and dairy products, and protein-rich foods such as meat and beans, salmon, and sardines. People with Parkinson's disease may eat less and lose weight because of difficulty swallowing. Exercise to increase hunger. The patient should omit from diet high fiber foods, unsaturated fat and cholesterol, white rice, dark chocolate, and red wine. The patient should avoid in diet, limit sugar intake, alcohol and caffeine, particularly before bed, and they may interrupt sleep. Also avoid alcohol. Supplement. Glutathione. Intravenous administration for better absorption. Function as an antioxidant. Vitamin D, 0.125 milligrams daily, and vitamin B12, 0.1 to 0.5 milligrams daily.